Hello, welcome everyone to another edition of Lupus Talks. My name is Ed Peterson. Of course, I'm just one of the hosts, of course, and we just continuing the growth series, of course, for Lupus of Nevada. And what we're doing on Lupus Talks with Dr. Calvin Williams and Mr. Lois Olson, both, Dr. Calvin Williams out of North Las Vegas, Nevada, in reference to what she's sharing and helping people who suffer from autoimmune disease and those family members or people you know who have this ailment. They can get the support, they can get the assistance, and they can get the true story as to how to help yourselves and help benefit other people's lives while dealing with that. So, without further ado, I'm going to let Dr. Williams take over. Calvin, take over.
Thank you. Thank you, Ed. I'd like to thank everyone who's on here and everyone who's listening. Ed Peterson, he's just been a joy and a blessing to us. And Dolores as well, my co-host. We're going to be talking about connective tissue disorders, and I'm reading I pulled it up on Google.com, and I suggest you do the same because you'll find it. Now, connective tissue disorders. Oh, first of all, Father God, thank you for what you've done. Thank you for us being on a podcast. In Jesus Christ's name, amen. Okay, connective tissue disorder. It's a group of conditions that affect the body's connective tissue, which provides support, structure, and protection to organs and other tissues. Types of CTDs are, and that's connective tissue disorder. There are many different types of CTDs, including immune CTDs, which I'll just say connective tissue, rheumatoid arthritis, systematic lupus, erythematous, scleroderma, polymyositis, hereditary connective tissue disorder, that is Ehlers syndrome, and it's a lot of them here. It's a syndrome made, and let me push this up. Okay, and we are talking about Marfell syndrome. It goes on and on, mixed connective tissue disease, and that's definitely what we're going to be talking about. Fibromyalgia, I have that too. Raynaud's phenomenon, I have that, and I have mixed connective tissue disorder. What that is that connective tissue disorder, it triples all over you. You know, you're being hit this way, you're being achy this way, you can't sleep, you're agitated. That's what that is. Okay, so as we go into the symptoms of the connective tissue disorder, can cause a wide range of symptoms depending on the specific type of disorder. Common symptoms may include joint pain, that's what I have now, and stiffness, skin problems, and your throat my throat is starting to itch, but I don't think it's from that. Skin problems such as rashes, ulcers, scleroderma, fatigue, muscle weakness, internal organ problems such as heart, lungs, and kidneys. What causes it? That's what you're going to ask next. The cause of the connective tissue disorder, it varies depending on the specific type. Some are autoimmune disorders where the body's immune system attacks its own connective tissue. Others are hereditary, caused by genetic mutations. Now, the diagnosis and treatment. Connective tissue disorder can be challenging as symptoms can overlap with other conditions. The treatment for this is depending on the specific disorder and severity of symptoms. Medications may include anti-inflammatory drugs, autoimmune suppressants, pain relievers, and bone strengthening. In some cases, surgery may be necessary to correct the structural problems or relieve the pain. So, Dolores, I'm going to let you go for this too, because you have a lot of joint pain and all of that. So,
yeah. So, this type of connective tissue disease, it could be from, as we know, and it's for autoimmune disease, generic disorders, cancers, And like I said, with the autoimmune problems, connective tissues are what many people think when they think connective tissue disease and these conditions. Your immune system generates chronic inflammation, and so in some parts of your body, chronic inflammation causes pain, like we just discussed it, pain, swelling, and permanent damage to your tissues. And some examples of it, autoimmune connected tissue disorders included. And as we said, rheumatoid arthritis, with the joint pain, and that you get a lot of joint pain for that. And there's a lot of things. They said also with there was so you get muscle. You also get muscle problems too. The muscle, the
Yes, you do.
weakness.
Yes, you do. Do you have that by any chance? Because you're always having problems with your muscles. Have they
Yeah,
done?
I get that time to time. Yes, I do. I
Do
get
you
feelings
have?
like that.
Okay, if I may ask, does fibromyalgia play a part in your muscle disorder?
Well, I have to go get it checked out, but I do have symptoms, but I have not been diagnosed for that part.
Mm-hmm.
They just
Mm-hmm.
been diagnosed from I having the osteoarthritis and
Mm-hmm.
the nerve, the nerve damage,
Mm-hmm.
and
Mm-hmm.
and I have the disc problems.
Yeah. Yeah. I noticed something like
I
that.
haven't been tested for that yet.
Mm-hmm. Well, they say that connective tissue disorder or disease, I should say, um, they said the two main categories of connective tissue disease are one, a set of relatively rare genetic disorders affecting the primary structure of the connective tissue. Again, I Googled that. Please google.com to get more information on that. Then we have the mixed one. So mixed connective tissue, Dolores, you and I were talking about that, where it layers us, huh? What
Yes,
you have it, you're layered. After one thing, you get another thing and another thing, and it just doesn't stop. It just does not stop. How do you cool down? And I'll tell you what I do with my fibromyalgia.
I just kind of do. Well, I know medications can't mask the condition, even if I take a medication for certain things, but I know it can mask. But what I do is just mainly I have to keep on moving, because if I
Mm-hmm,
don't keep on
mm-hmm.
moving, I will be stiff.
Mm-hmm. Mm-hmm. That's me too. It doubles on me. Like last night, I was doubled. I had to put a heating pad on my arm because my arm felt like it just gonna fall off. It felt as though it was just gonna fall off because it was in so much pain. Now in the daytime, I relatively don't have it. That's the strange thing when I talk to my doctor in 2 months from now. But he had signed me up, which I'm so happy for acupuncture. And I know that works because it worked for me 3 days a week in California. And I need that so they can figure out also what's going on. The more the merrier, I said, because the connective tissue disease, is a group of disorders involving the protein rich tissue that supports your organs and other parts of your body. And they said examples of connective tissue are fat, bone, and cartilage. These disorders often involve your joints, muscles, and skin, but they can also involve themselves with other organs and organ systems, including the eyes, the heart, the lung, the kidneys, um, your gastarial tract, and blood vessels. They are more than 200 disorders that affect connective tissue uh, and cause the various symptoms. I didn't look up when the connective tissue, when it was around, when it was discovered. I didn't look that up. That's one thing I'm going to look up. When was it discovered? Because it takes a lot of people out. not dying, but there's so much pain. And you see the women's, the young and the old, are sitting down there rubbing their hands, putting them together, and it's hurting so bad they're trying to massage their hands. And I know the feeling. I know the feeling. That's why when I go out, it's cold today in Las Vegas, so I have to go out with some gloves on, warm clothes, and do it like that so I can be, warm. But they talk about also, oh, do you have anything else to say on that? Like connective, the toxic chemicals found in things such as pollution and cigarette smoke. Are you ever around cigarette smoke? I know when I go to the casino, to the buffet, there's so much smoke, I get sick. Honestly, I get sick.
I'm gonna tell one thing, and then I'll get to that too. I also use the heating pads because I've been going to treatment for for chiropractor, and also that's what I've been doing also. But no, I don't be around cigarette smoke.
Mm-hmm. Mm-hmm.
That affects me. That close up my lungs. I'm allergic to cigarette
Mm-hmm.
smoke.
I know.
Close up my lungs.
I just walk through. And when I walk through, I just like, oh my God, I can't do this. I was with the family. I can't do this but they did give me an oxygen tank, and the oxygen, the oxygen to the wall connects. But the little oxygen ones they gave me as a temporary till I get the small one I can put in my purse. The key doesn't work. The key is too small to turn on the oxygen. So I'm in a dilemma now. And here's what you do: poor nutrition, mostly lack of vitamin D and C. Now you stress you stress nutrition all the time, right?
Um,
Nutrition is the key.
I have pretty much good. I eat pretty good, but see, the problem is that when my thyroid comes whacked off, I get cholesterol problems. And
Mm.
so yeah. And so that's the term because I pretty much I eat pretty good.
Mm-hmm. 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 Okay. I know I'm I avoid ultraviolet light, because that triggers off my lupus. It triggers it off real quick and I can't do it. So that's why you kept me, I'm in shades all the time. When I saw you a couple months ago, about a month ago, I'm in shades because I can't have my eyes connected to the ultraviolet light. They talk about inherited disorders of connective tissue. Some connective tissue diseases, often called heritable disease disorders of connective tissue, which is the HDCTS, result from changes in certain genes. Many of these are pretty rare. The following are some of the common ones, and fibromyalgia, leukemia. Those are the following ones: early signs of chronic leukemia, and this can run into many different things, And I stand back and I say, "Oh my God, what else do I have?" When I go to the doctor, what else do I have? What else do I have? So that bothers me quite a bit. And you can hear my voice; I'm kind of slow because of the pain that I've been going through, and I can't take a pain pill, not at all. They gave me a sleeping pill, but what good is a sleeping pill in broad daylight and I fall asleep, you know? So it's just one thing after another, when your muscle weakness, the fatigue, the trouble swallowing, shortness of breath, fever, weight loss. I think it has a lot to do when you get older. I really do. It has a lot to do because I get fatigued if I if I leave and go from my bedroom to the washroom. I'm fatigued, Dolores. I'm tired. And that's putting clothes in there. And that tells me something right there. Tells me that I'm older. that I'm that I'm getting older since tomorrow is my birthday and I'll be 69 years old. That's what it tells me. But I thank God for living 69 years. So do you have anemia? I have anemia. loss of appetite? Do you have any of those, fever, fatigue? Have you, um, has your body been involved with any of those, Dolores?
Actually, I want to say happy birthday to you.
Oh, thank
May God
you.
bless you with more years to
Thank
come.
you.
And
Thank you.
and then the second is my blood is pretty good. I used to get anemic real bad back in the days, but it's pretty good now.
Mm-hmm,
I'm
mm-hmm,
no longer anemic. I just have to I take iron for the rest of my life.
mm, mm-hmm, mm-hmm.
Yeah, and so I just take one pill. I used to have to take two pills, but now I only take one pill, so my iron's pretty good.
Wow, that's good. Did you know rheumatoid arthritis can lead to a permanent joint damage and deformity? Did you know that when you see the hands curled and the hands spread out and won't get close, that's a deformity? Have you seen that with people when you go out?
Yeah, there's a lot of things. Um, I think I've seen people who experience with rheumatoid arthritis, and it gets so bad that their hands curl up.
Yeah, yeah. I've seen some of the lupus people who had problems like that. And they also said the localized sclerodoma is confined to the skin, you know, and sometimes the muscle beneath it. Systematic cirrhosis also involves the blood vessels and major organs. And Sjogren's syndrome, since they said I had that, is a chronic disease in which the immune system attacks the moisture producing glands, such as those of the eyes and mouth. So I have some of that, whatever, that liquid to put in my eyes. The effects can range from mild, uncomfortable, or crippling. Another dry eyes and mouth are the main symptoms of Sjogren's. Many people also have extreme fatigue and joint pain. The condition raises your chances of lymphoma, and may cause problems with your kidneys, lungs, blood vessels, digestive system, and nerves. Now, we're talking about this, and I'm just thinking, I, I don't think gloom and doom. I think that if you have the proper nutrition, the proper exercise, the right mind, you get up in the morning, you do your prayers, and you say, okay, what's on my agenda? You have your little log, you know, your little journal, and write down how are you going to accomplish these things you want. Don't write 10 things down. You can write 4 or 5, and if you can't do that, write 3. Do that and see how your body feels. Is that what you do as well, Dolores?
Oh yes, every day I pray. I got this little prayer book too. I said prayers every single day. I have that, and then I have my regular prayers, and then I also too, because it feels so good. And you read the Bible and that, it feels so good when you do that. That
Mm-hmm.
combination, it makes you feel so good. You feel so calm. You feel at ease.
Yeah, yeah, that's what I do. I feel that. You know, earlier I was saying that SLE, which is systematic lupus erythematosus, SLE, is simply lupus. It's a disease that causes inflammation to the joints, skin, and internal organs. Symptoms may include, and this is what I was saying, a butterfly rash, a butterfly shaped rash on the cheeks and bridge of the nose, sensitivity to light, mouth ulcers. Because when I was little, I had a bunch of bumps inside on my gums. And my mother used to tell me, girl, those are live bumps. And I thought, well, I must have told a lot of lies, Mama, because I got 3 of them right here. And so I used to go in the bathroom and I used to push my chin with my finger to pop those, to pop them, pop the water out of them. And it worked. It hurt, but it worked. And I wasn't supposed to do that. So a lot of people suffer mouth ulcers, hair loss, fluid around the heart and or lungs, kidney problems, anemia or the blood cell problems, problems with memory and concentration or other nervous system disorders. Now that's what I have too. Problems of memory. I could be looking for something, and my brother would say, it's in your hand. I said, where's my phone at? I always lose my phone. And he said, well, if you look in your right hand, you'll yeah, you'll find it. And, it's just, we have to laugh at that. We really do, because we're running around thinking we lost something. Or, the common thing that people lose is glasses. They put the glasses on top of their head, and they're looking for glasses, and it's on top of their head. So we have to be aware of that. These different symptoms are very, very troublesome for someone who has lupus, because I grant you, every one of us had at least one to three of these areas that I talked about. All of us. They go to now, vasculitis is a general term for more than 20 different conditions. Isn't that something? That cause blood vessel inflammation. Were you going to say something, George?
I was agreeing.
It can involve any of the blood vessels and affect blood flow to the organs and other body tissue. I remember I was supposed to go to the therapist. I think I told you because you were in there for my what do you say, vertigo. And I went in there one time, and I thought they were going to deal with everything. The vertigo. I thought and it wasn't about that. And I said, well, I got to go, because you expect me to be on these 2 bars holding my hands on this. And I told you, I have no feeling in my right arm, and my left arm is hurting. Now, how am I going to walk down that path and my hand is hurting? So I went back to my doctor, and he said, well, did you go there? I said, one time, and I canceled them. We need people that are going to help us. We need we need people to understand what we have. And I'm finding that a lot of individuals don't know. The doctors know. My doctor knows. My other doctor knows. There are a few of them that need to be more educated in this, but the majority that I have been around, they know what I'm talking about. Because I don't go in there when he says, how you doing? How you feel? Oh, I feel great. You don't ever say that. If you have not been feeling good and you go in there and say, well, I got to put on an act, you're not going to get help. They're not going to help you. They're going to say everything's all right. Have you experienced that, Dolores?
No, I haven't had that experience before. Because I always just tell them straight up how I am, how I feel.
That's good. That's good. And this is what this podcast is about. Be strong. Be your own CEO. Be strong, and you know what's wrong with you. You know what you have to tell your doctor. And like I said, I even called in. I said, I need acupuncture. I don't need another doctor to find out about my bones and tell me I need a shoulder replacement. No, that's cutting into your body, causing another problem. I'd rather not. So my prayer is that this acupuncture will help. So those are the things that we have to go through with these several things. Mixed connective tissue, it has symptoms of several diseases, including lupus. Did you know that? Mixed connective tissue have several symptoms of but it includes lupus. Isn't that some scleroderma, a variety, rheumatoid arthritis? When this happens, your doctor will diagnose you with mixed connective tissue disease. They say while many people with mixed connective tissue disease have mild symptoms, others may have life-threatening health problems. And they diagnose it to diagnose connective tissue disease, your doctor will give you a physical examination and ask about your personal and family medical history. You may also take one or more of these tests: the blood and the urine test, x-ray, and MRI scans, which show images of your bones, organs, and other internal structures of the body, tests for specific antibodies, tests for check of inflammation, removing a sample of the tissue from your body. I had that done. to be tested in the laboratory because they do what is it? Dexter. I think it's something like that. Dexter every year testing, my bone and how they do that. They inject that needle in and pull a little bit out. Dexter scam. I may be not pronouncing it right or not, whatever. If the people out there know what I'm talking about, please write in and tell me. So, and they test for dry out eyes or mouth, and that's what I'm having now, dry mouth. So we need to understand that the treatment of connective tissue disease will depend on which kind you have. You can't just say, oh, I have that. Treatments range from vitamin supplements to physical therapy and medication. I can't stress enough physical therapy. I can't stress that enough. Because the medications, they're just going to mask the problem. They're going to put a Band-Aid over it. So you have to talk to your doctor if the symptoms get worse or if you have new ones. Unless you have anything to say before we get off the air, because it's 2:32 with my dry mouth.
Yeah, I totally agree. Medication does mask everything. That's why it's good to have other options to add with that, because you don't want to get too strong of medicine, because all it's going to do is just make us just wiped out. But the more, if we could deal with it with the medication, do some form of exercise that's safe.
That's right.
For your joints, the more better.
Yeah, that's right. That is so right. Well, I think this is our time to say we'll be back next Tuesday. I'm connecting you with Edward, and he can go for it. Edward.
All righty. Thank you, Dr. Williams. That was a beautiful discussion that you guys have. So, Mr. Williams. Olsen, I'm just going to say this. It's just an opportunity for us to continue to educate and uplift each other in our communities that we serve, making sure that we are on point when it comes to how we grow and how we help on multiple levels, regardless of what people think. You're not an island. You can't do it all by yourself. You will need a support group. Lupus of Nevada is that opportunity for you to get that support. You can always go to the website at lupusofnevada.org. You can fill out the form on there, and if any questions or anything you can answer questions you have or concerns you may have, we can basically address that right away for you. And we look forward to continuing sharing this also on our Facebook page. You can go there, as well as the YouTube channel too, as well, Lupus of Nevada. On our YouTube channel as well. And so we have other platforms that we use to help to spread the news and spread the opportunities that we share. That's going to be a blessing and also an educational piece for you as well. So just continue to connect with us. You can also donate and support our organization right now, Lupus of Nevada. And this is going to help you help others in the process with the current information that's going to be relevant to you and to the ones you know. So with that, any final thoughts?
I just wanted to tell everyone, this is a serious disease. And if you have several problems with your health concerning lupus, I suggest you check it out with your doctor. Research. That's the key. Just research. And the best thing I can do is pray. I said, Lord, lead me where I need to go. Research. Because all it does, if you don't, it gets worse and worse and worse. Thank you.
All right. Dolores?
And the best thing to do too is create a plan that better fit for your life, that when you go through anything, you'll know how to deal with these certain issues and how to comfort yourself during your conditions.
All right. With that, I want to thank you all. Until next week, you guys keep the faith and also keep building the dream.
Thank you.
Thank you.